Right, Tarun.
Hi guys, this is Dr. Marwah, and it gives me immense pleasure to introduce to you Dr. Subhabrata Biswal, who has been my former student from Cuttack. I met him last time in 2018, and here he is once again, beaming with all the smiles. The familiar smile of him is what I can see once again that I used to see in my class earlier. And here he is with an astounding rank in NEET SS exam. I mean, to get a double-digit rank in NEET SS exam is itself a no mean achievement, and he has got a rank 37. So welcome to this quick interview, doctor. And it also gives me immense pleasure to introduce another former student of mine, Dr. Abhishek Dr. And he's got an astounding 32 rank. Good to see you once again. Dr. Abhishek is from Hyderabad for all the viewers, and Dr. Subhabrata is from Cuttack. He's done a post-graduation, Dr. Subhabrata. He's currently working at AIIMS Raipur. So the stage is all yours, guys. Heartiest congratulations, and I would say hats off to your dedication to get these ranks with all that hectic clinical duties that you guys have. So I'll begin with Dr. Subhabrata first. Hi, Subhabrata. How are you feeling first? And then what would be your goosebump moment of your entire residency?
Thank you, sir. Thank you for the welcoming words, sir. And great to see you again, sir. I'm a little bit excited, but I'm also happy also, sir. And after I have done my undergraduate from SC Medical College, Cuttack, sir. After that, I joined at All India Institute of Medical Science, Raipur. I have just completed my MD Medicine on the month of January 2023, sir. We are COVID batch 2022, and we faced COVID. And during residency, first year, I didn't get enough time to read, sir. But I used to, whatever the cases I see, I go and read case based only. And during third year or second year end, I started preparing directed for super specialty and my NEET SS preparation. Proper prayer started in the third year only, sir. And during residency, my sir, what I can remember one goosebump moment, when in casualty during that COVID time, I was in the night at around 3 a.m. One patient with severe chest pain, sudden onset severe chest pain, suspected a myocardial infarction, and he was a driver with accompanied by another driver. So I evaluated him, took a ECG immediately, and ECG was suggestive of ST elevation MI, sir. Then I started thrombolysis as per the guidelines, sir. Then the streptokinin infusion was going on, and he was on continuous monitor, but he didn't get any bed. So he was on the stretcher only, but I didn't waste the time, so I started thrombolysis. And almost 80% of his thrombolysis was complete, but suddenly he developed tachycardia and went into VT, sir. So I was panicked, but I rushed immediately into the crash trolley. I took that and I started CPR with our supportive nursing staff, and with 1 to 2 cycles of CPR and one shot of ADR, he recovered, sir, successfully. And I didn't got any time to bring that screen for CPR. Then everyone was bystanders and other people were looking at that scene of what's going on. Then after 20 CPR over, he recovered. He woke up and was sitting, and everyone is looking at him and me also, like what he has done during the last 5 to 10 minutes. Then I was shocked. Did I saved him? Then that everyone started clapping, and it was a goosebump moment. And then I
we
thought,
also clap for you, doc.
For this only I took medicine, and then I felt blessed, and simultaneously was proud of myself. And you are the one of the pioneer teachers, sir, from whom I have got my inspiration from my UG days, sir. So thank you, sir. Again,
hats off to you, to your dedication. I mean, changing lives. People just post on social media that they want to heal the world, they want to change the world. They don't do anything. And here we have these heroic doctors, both of you, and you have changed so many people's lives. Like, this guy would have been like dead, I would say. the family members would have been taking part in cremation ceremony, and you made them sit up after 10 minutes, and hats off to you. I mean, to handle on a trolley with limited facilities to ensure CPR and all timely aid. So great, doc. I mean, I think that is a story that always needed to be shared. And welcome to the discussion, Abhishek. How has your residency experience been?
Yes, sir. We are popularly known as the COVID batch, sir. We actually
Okay.
realized the importance of everything during our residency. When we joined our residency in 2020, no one was willing to travel. We traveled all over the state, all over the borders, and we started the residency. No one was willing to go out of their home. We went out of the hospital. No one was willing to touch a
Oh,
COVID patient. We had to go to COVID ward. We had to change their Foley's. We had to put central lines. If possible, if necessary, we had to intubate. So that's how I realized that COVID has made me learn a lot of things. I realized that what is the importance of time. Before it exhausts, we need to use it. So before there, at the time of COVID, there were no hardly any patients. Other patients, they were refused. No one was coming to hospital. So now our wards are full of patients. ICU was full of this, and we have rounds. So we need to appreciate the value of something when it is with us. So that's what I realized at the time of COVID. We saw many deaths. We saw many of them survive. Many of the patients still keep calling us like we are good, like that. So now the times have changed. You are good to go. You have the freedom. You have the freedom of attending live classes. You have the freedom of talking live to patients. So that's what I realized. It's very good from 2020 to 23. This change is very good. Like
only a
it is
frontline
exciting.
warrior can understand. Only a
Yes,
frontline
sir.
warrior can understand this.
We-
Ordinary souls don't understand what you are talking. I mean, what you are
yes, sir.
talking is
They're like completely
golden
anywhere.
words, diamond words, I would say.
I totally
So,
agree.
doc, yeah, yeah.
Like one COVID patient, he was there for I think during my COVID posting, he was there for 20 or 30 days of long admission, sir. And I was in PP, so he was eating biscuit. He offered me, sir, you want some biscuit? Then I asked him, no, it's okay. You have the biscuit. Then I said, is there any issues? Let me know. Then he said, I'm a retired teacher. I was a freedom fighter. I am 96 or 90 plus, around 100. I've lived my life, but I'm happy that you guys are serving. Then after my COVID posting, he also got discharged. I didn't know when, but during my OPD days, he came for follow-up. So he came to me, and after I was taking his history, he said, "Sir, I have heard you during my COVID." Then I felt how is remembering my voice. I was in PP, and he still remembers my voice.
That's
Then he,
what exactly.
Awesome, awesome. Exactly. I mean, these are the perks of doing this job. It's not about money. What we do is exceptional. I mean, it's not about money. It's about these things. I think ordinary people would not be able to appreciate. But golden words from both of you. So, Doc,
Yeah.
since this interview is for the future aspirants who would be preparing for NEET SS, let's start with you, Subrata. Like, how did you go about using the PrepLadder app? And what were the high points of using the PrepLadder app for your preparation?
sir, like during medicine residency is very busy. Like you won't be able to cover theoretically all the aspects of medicine. So I will better advise the future aspirants in the residency period, first year you just go and read the case-based topics. And if you are selected your branches of specialty, super specialty, then you can in the second year or third year you will get some time in for reading those topics. And in the last paper, what I have realized is most of the questions, like 80%, you can expect from Harrison only. So, and Harrison, what was my approach is like I used to make the screenshots of all the Harrison's table, and I completed my MD medicine in the month of January. So I got a few months of like 5 to 6 months of question for my preparation. So I started. I initially during my preparation, I took screenshots of all the Harrison tables and figure. I compiled them into a PDF file, and during after that my MD medicine, I joined as senior resident. So I was working, and simultaneously I started my preparation. So in the morning, I used to get up and I used to study all the Harrison's tables, and like so that I will get a lead of 2 to 3 hours in the day, and in the evening after returning after my duty, I used to again what are the left topics I used to cover, and before going to sleep, I used to do 2 to 3 question bank from the upset, and then next day before going to sleep, I will prepare my next day schedule. So I used to keep a small note that what should be my next day's plan. That's all, sir.
Oh, inspiring, inspiring. Doc, I wanted to interrupt you, but I did not. How did you have this super energy to get up in the morning before going to duty, study, do MCQs from PrepLadder app, come back? I mean, is PrepLadder app addictive enough, or is it your super dedication, or is it a combination? I want an honest opinion.
Sir, it's the effort of teachers and the love of medicine that inspires you, sir, to do these things.
Yes, absolutely, absolutely, absolutely. Abhishek, your bites on the same. I mean, what would be your advice to the future aspirants of how to go about using the PrepLadder app, the QBank especially, and I mean, what was your methodology and what would be your advice to the future aspirants?
Yes, sir. I completed my final exams in June, sir. So I hardly got 2.5 months of preparation time. And what I would like to advise students is that we should be thorough with the concepts of Harrison in these 3 years. It can be from PrepLadder or any app, and some students prefer learning. It's anything, but your concept should be clear. And after that, what I followed was, if you see this paper of NEET, it's purely clinical. Though it seems easy, what they did was they twisted between the two sentences or two lines or the last word. So you need to have 100% clarity about the concept, then only you'll get the question right. So what I did was retro reading. I first did MCQs from QBank or tests. Then I went back and read Harrison. And Harrison also stressed on the questions which were asked and on the tables which were important. So that's what I did. First I did MCQs and then I went back and read from that. So that when I read Harrison, then automatically my eyes used to highlight the questions. This can be asked as a question. This can be asked as a question. Most common symptom, most common sign. This can be asked, so that I got that approach. Initially retro reading won't be fetching, like in first 1 2 weeks you'll feel that it's boring and you cannot cover more, but after you get used to it, retro method is the best method to read, like in a short span of time.
So both of you have been doing exams, class 10th, 12th, NEET UG, NEET PG, now NEET SS. So since you are veterans and champions of giving these exams, the question is, how did you handle pressure or performance anxiety 1 week before the exam? First, Subrata, you bites from you regarding what was your thought process 7 days before the exam, and then Abhishek, you can take the lead for the same.
Sir, like rightly said by you, sir, like preparation is not only on studying only. So you have to handle all those bystander factors, sir. Like you have to do and there will be any distracting factors. There will be some exam postponement will be there. So rescheduling will be there. So you don't get distracted by all these things, and you have to stay focused and stay till the end. You have to be in that process. And another thing, like you need your family support, sir. And another thing I want to add, sir, like it's I will tell, sir, like medicine you have to stay motivated at daily you have to make a routine of yourself, and you can do what, sir, like small topics also you can cover, not that you can cover the vast topic every day. And there will be some weekdays also, like you won't be able to get time to read daily. So but whatever chances you are getting during preparation, so you just utilize those hours, and stay motivated and stay with a cohort, like study similar partner. You can and have your study partner, like they will also motivate you. So I what that was my strategy, sir.
Okay, Abhishek, how are you handling this 1 week before the exam? The pressure.
7 days. Yes, sir. 7 days before exam, I was really very, very tense. Like to go about what
Okay.
about the rank. Like this exam is not only about knowledge; it's also about the stress you handle. Because I am currently doing senior residency here, and that's what more important is the people you care for, your family, your wife, or your friends, your close friends, you talk to them, and the dream of achieving your branch and the dream of the days ahead. Like what I had was, my wife is doing her residency in a faraway city in Bhubaneswar. She would come back to me after my exam. So that was my dream. अच्छे एग्जाम अच्छे से दूंगा, बाद में चिल करूंगा. ऐसा, it was my dream that only once this exam is over, everything is going to be good. And my parents, they were like always there with me, supporting me, encouraging me. You can do it, you can do it. Even my father, he came back to accompany for me for my exam. Like it was like from the school days he used to do. This is your last exam. This also I'll come. So that's what my mother, my parents, they are like really back with me. And my close friends, I used to talk to them for 1 hour or so, like this stress, their stress. We used to like blurt out our stress, and then we used to go back and read. That's what we used to do. So parents and your wife and your friends, close friends, those are there with you. And your teachers, of course, they're like pushing to you. Our teacher used to say that at this point of age, you should not like keep on reading. You should earn for yourself, you should read, and you should work for yourself. These three things you should be able to do simultaneously. Not only now, in future also, I will like implement the same in my life. That's what I thought. So this exam was different. NEET PG was like I used to only read. This exam was different in that way.
Words of wisdom, super words of wisdom from you.
Sir, I also agree with Abhishek sir. Like my parents also, they came during last 2 months of my exam. They also came to Raipur only to support me. Like I shouldn't have any distraction with food, any issue of food, outside food, getting sick, eating outside food. So they also, my parents both came and stayed with me, sir. And I had also like long distance study partner, sir. She was studying at Cuttack. She was also preparing, and we used to do video call, and we used to study together, sir. And at the night before going to sleep, we used to ask what is your today's work, how much work you have, how much effort you have put, and how much I have put, and and regularly we used to give duty together, sir, and we'll share our ranks and our strategies together also, sir. So that can be like, if you get a good study partner, that will be good, sir.
Okay, so another congratulatory messages from my side to both your better halves as well. And a question that's coming up next is, I get this query from a lot of aspirants actually who are currently doing post-graduation. I mean, is there any role of taking a subscription of UpToDate, or like how would you suggest, or first is, should you be taking a subscription for all the updates and UpToDate, for example, or any other app, etc.? Apart from, like you are obviously, one will try to use multiple sources. So like you use PrepLadder primarily for your preparation. That was your primary source of preparation. But then as far as UpToDate is concerned, or any other resource is concerned, would you suggest suggest them to take a subscription in the first year once they join their post-graduation?
Yes, sir. Like in the initial period of past 6 months my residency, there was no UpToDate subscription in my college, sir. Then we are planning to our PG seniors and our batchmates, we planned we'll get a group subscription of UpToDate. Then luckily at our institute, that institute subscription came, sir. So I utilized managing cases, like if I have any doubt in what should be the next step in management, what should be the next guideline, exact guideline, so that I shouldn't do a mistake in managing that case. So in between, I used to refer the UpToDate, and my duty area, there was computer system was there. So I used to log in my UpToDate account, and I used to just refer what are the next management of this patient, what will be the good one. So I think it is a good resource to use. And I was lucky enough that James had this institutional subscription for UpToDate, sir.
Yes, sir, we should take UpToDate. Like the most important thing about medicine is to keep yourself updated. Not only about UpToDate app or any new articles or anything, you need to keep updated. Otherwise, you will stay back. So UpToDate subscription, like it is needed. Group discount or any. There are many ways. Like
there are many ways.
we can get UpToDate.
yes. We'll not discuss those other ways.
So UpToDate to chahiye. Yes, sir.
Okay.
Yes, sir.
So coming to the last question for this very hearty discussion, how did you feel when you came out of the examination hall? after you've been veterans of giving so many exams, right? So what was the feeling like? How was this when you came out of the examination hall? How was it different from any time else? Was it relief? Was it like, I'm not going to give any other exam ever again in my future? This is the last one that I'm doing. I mean, how are you feeling? Subrata, first you, and then Abhishek can take the lead.
Sir, like early morning when we reached the exam center, we were in hurry that the exam should begin as soon as possible. And I was little bit, to be honest, I was very, sir, like tense, and my heart was throbbing like 100 plus heart rate. Then I thought,
So this exam fear lives with us for all our life. I wanted to hear that. Okay.
whatever, sir, like I saw one of my faculty was invigilator there, sir. So he said, then I said, sir, this is my last exam, sir. I am not going to give any more exams. Then sir said, beta, you have to crack this. Then I said, sir, okay, sir, we'll see. Then there was, sir, 1.5 hour pan-India delay was there, sir. So we are so much frustrated, so humid condition, and there was so hot and humid, and we are like sweating and anxious when the exam will begin. When the exam will begin, we are waiting like that. Never.
So they make it. They ensure that you are physically fit also to handle that. Okay.
Physically and mentally, you have to be strong, sir. Then I slept. Then I thought, after 15-20 minutes, I thought, no, this is not gonna happen now. So I will take a nap. I took, sir, that the good thing I did. I took a 30 minutes nap, sir. And after waking up from that nap, I felt so much refreshed that I said, now give it, just give me the paper. I will give it now. So I was confident after. So these factors will be there. Some environmental factors will be there, but you have to be mentally and physically strong, sir. And the good thing I did, I slept in the exam hall only. After 30 minutes of waking up, then I was feeling refreshed and I was confident, and my heart rate also settled to 30, 60, 70 rate. Then I was okay. Then after coming out of the exam, and there are many batchmates were there. So we discussed how was the paper. All of them said it was okay type. Then I said, it was standard paper only, sir, not that much hard, but it was tricky, and like Abhishek, Dr.
Options
Abhishek,
were tricky.
yes, sir, it was tricky, and you have to pick that keyword, sir. And what was my strategy during that exam, sir? I used to mark all the question, like from the very beginning of my every exam. Like I used to do as much as possible fast. I can answer all the question. Like I will round one, I will complete within in 45 minutes or 1 hour of time remaining in the exam. Then I again the rest 1 hour I will utilize for revising the left question and revising reviewing any options what I can improvise. So that was my strategy during exam, sir.
Were there any bouncers in the question paper? Like you read the question and you said, no, this is beyond me.
Yes, sir. In every paper, there will be 5 to 10% of bouncers will be there, but you have to dodge them, sir. Like MS Dhoni movie, that's an inspiring movie, sir. So you have to dodge the bouncers and that they are always will be there, and they will make you clean bold. So just stay away from those questions.
Abhishek, your take on the same examination
Yes,
hall
sir.
experience?
After I wrote the exam, what I felt was it is maza aa gaya. This is a clinical paper, and it will be answered by only general medicine residents. Unlike the previous paper, which was like more like a NEET PG paper, it was more like genetics and stuff. This was a clinical paper, so those who did residency would like it. Like I liked answering the questions. I got some of them wrong, but I liked the way he asked those questions. That's what it was good in that way. And those long questions and the stem. And what I found was that in spite of one specialty, you should have good knowledge about every specialty: critical care, palliative, endocrine, rheumat, everything. Not only one specialty dominating over the other. So jack of all trades, master of none. That's the same good. That's the same thing which holds good for a physician and this paper also. It is like you know more about one branch and you know less about nothing about the another branch. It doesn't fetch you, because 1 mark of critical care and 1 mark of toughest cardio question, both are giving you 4 marks. So you should have minimum knowledge about everything. That's what you need to train yourself in your residency, and that's what the paper is also expecting us. So that's what it is, fun in that way. You get a like you got a question on ultrasound, you got a question about histopath, you got a question about this. We see these things every day. So in that way, it was fun answering those questions. And again, if you twisted between the options, so if you read Harrison and you are completely thorough, then only you'll get it. And one more thing was time factor. Unlike Suprabhat, what I do is I read question only once, because what I feel that if I overthink, I tend to get it wrong. So
Okay.
that's why I advise participants to answer it in grades. Like I go about 30 questions in 30 minutes, take a 2 to 3 minute break, then again 30 questions, then again 30 questions. Then you'll get it in 5 rounds. So you'll get a 1 to 2 minute gap, 2 to 3 minute gap between it, so that you can channelize your mind. Okay, this paper is like this. In the first 30 minutes, if the paper is easy, you'll get to know. Like these are only one-liners, you can go a bit slow. But this paper was lengthy, so you need to go a bit faster. So I advise all the participants to take it in laps instead of reading all 150 questions. I think only few can do like that, 150 questions, because mind will be like will go in a state of fatigue in 135, 140 questions. So take a gap of 2 to 3 minutes between the questions and then go again. So in that you'll get all the questions, like you'll be able to remember what you read and you'll be able to apply it. That's what I feel. But it is a clinical paper, sir. Every resident would love to answer that paper. That's what I felt at the end. Even though I get a rank or not, I felt it was fun and I did my job. Rest all will God will take care. That's what I felt.
Yes, sir. Like Abhishek said, we enjoyed this paper very much, sir. This year paper was very like you will enjoy while while answering those questions, sir. And regarding sir, few lengthy questions will be there, sir. But you have to. What was my strategy? Like I used to see the last word first, sir. But is like some many times they will be like what all except. So those are for bouncers like balls, sir. They will make you wrong, marking the wrong option, sir. So what was my strategy? I used to read the last word first, then I will again come back to the first line, and if I am able to, then simultaneously I will look for the just overlook all the 4 options. What are the options? So while reading those the summary and the body part of the question, I will try to fit if any exclusions are there. So I will exclude all those few options, and at the final I will mark what would be the best option, sir. That was my strategy for lengthy and long questions, sir.
Great, Doc. It's been an excellent discussion. High IQ, high adrenaline, high dopamine release discussion from both of you. And it's an immense pleasure to see you again. I mean, I think I can continue with this for another hour, chit-chatting with you and interacting with you again, since you are anyway my former student. So it was a pleasure interacting with you once again. And on behalf of PrepLadder, I would like to thank you once again for coming for this interview and sharing your wisdom and tips for the future aspirants. And I sincerely hope that they'll find all the bits that you have provided useful for their future preparation. Among the last 1 minute of this video, if any dedications are there, Abhishek, you can take the lead this time. I mean, any dedications both of you want to make, the stage is all yours.
Yes, sir. I would dedicate this to my parents. Like they have been there with me all through my life. This is my last competitive exam. After this, exams will be there, but not this pass or fail exams will be there. And my wife, who has been there with me all through this struggle, and my friends who have motivated me and who have took me forward, and they were always there. I'm forever grateful to you. That's what. Thank you,
Great.
everyone. My teachers and you, sir. You are always there, like from our UG, PG, and then you have been evolving your teaching as well. So
Yeah.
our teachers, our parents, and our life partner, they are there with us all through our life. Exams will come and go, but loud people will stay with us forever. That's what.
Yes,
Sir,
Dr. Subhabrata.
I come from land of Lord Jagannath, sir. So I wanted to just convey my sincere thanks to Lord Jagannath. By His grace, I am here, sir.
Yes.
Then I wanted to dedicate my success to my parents, sir, and my brothers, elder brothers. They both are in army, sir, and they are also serving in a different manner to country. And dedicate to my one of my batchmate, Dr. Chandan Singh, flying officer. He is a FMC pass out. So currently he's
Okay.
doing the Dharma residency. He requested me just mention my name in the platform.
Yes.
So, and he had supported me, and he had also inspired me during my residency. He was my companion. Whenever I get depressed, he used to help me a lot. So I also want to dedicate to Dr. Chandan Singh, sir, flying officer.
Great,
Yes, sir.
great,
One
guys.
more.
It's
My
been,
brother
yeah,
also.
sure.
Yeah. My parents
Okay.
means my brother is also there. He's my elder brother. He had been like my
Okay.
mentor all through. My brother and my Vadina. Yeah. Those two also. They are like my parents. That's what my parents and those. That's what I. Thank you, sir. Thank you very much. It was fun.
Thank you, guys. It was really, really nice. Wish you the very best. And Abhishek, I hope to see you again very
Yes,
soon in
sir. We will.
Hyderabad. When I drop by, I'll
Yes,
drop
sir. Sure.
you a message. And Dr. Subrata, if you are in Delhi sometime, let me know. And if I pay a visit to Raipur or whichever place you finally decide, maybe we meet again. Destiny helps us meet again. So God bless
Yes,
you.
sir.
And I'm
Sure.
really proud of both of you and your achievements. And I wish you the very best for your future careers.
Thank you,
Thanks a lot.
sir. Thank you very much. It's a
Thank you,
fanboy
guys.
moment for us to talk to you.
So,
Thank you. Thank you.